of your lower back and build some really good glute strength. To perform the movement, what you want to do is lay on your back with your feet nice and flat on the ground with your knees bent. Your feet should be shoulder width apart, okay? So laying nice and relaxed on your back, have your hands nice and flat on the ground. This is your starting position. What you now want to do is squeeze through the glutes and push your weight through the heels of your feet, lifting up towards the ceiling, okay? Once you're in this position, your hips, your knees, and your shoulders should be in a nice straight line. Holding this position for 3 to 5 seconds and slowly lowering back down, okay? Then you repeat that up, getting a nice good squeeze and contraction through your hips and glute. 3 to 5 seconds and slowly lowering back down, okay? We'll go again, up towards the ceiling. You shouldn't feel this in your lower back at all. You should only feel it in the glute. Coming back down. When performing the movement, you should be able to try to hit anywhere between 8 to 10 repetitions, 2 to 3 sets. As you get stronger and more confident with the movement, you can progress this movement. You can add a resistance band to the front of the hip, hold it down with your hands and push up against the resistance. And then you can also increase your sets and repetitions to say 15 repetitions and 3 to 4 sets. So the next exercise is called a pull-off press. It is hands down one of my favorite exercises for a core engagement in a oblique workout. Okay? To perform the exercise, you'll need a resistance band or a TheraBand. You can attach it to a door handle or sort of just shy of chest height on a pole. You want to wrap it around the pole and then we're going to use that to perform the movement. Okay? So to start off with, what you want to do is come over to where the band is attached to the pole. Face perpendicular to the pole, have the band out to the right of you, and you want to step and create some resistance, okay? So the band, your hand should be sitting in the midline of your body. You come down into a semi-squat position, nice and controlled. You're then going to press the band in front of you, holding that tension for 3 to 5 seconds, and slowly coming back to the midline, okay? When performing the exercise, you should feel it on the opposite side that the band is. The band is wanting to pull you and rotate your torso towards the pole, and you need to counteract that force by engaging your obliques and your core, okay? So we'll go again. So in a nice, strong, relaxed position, you're gonna press the band out in front like so, holding that for 3 to 5 seconds, and slowly coming back to the midline. We'll go again, out in front, holding that for 3 to 5 seconds, and coming back to the midline, okay? Once you've performed it on one side, you want to flip it around, turn your body around and perform it on your other side as well. It will work the opposite oblique and core, okay? When starting off with the exercise, start off with a low resistance, slowly build up to a stronger band. Start with anywhere from 8 to 10 repetitions, and as you get more confident and stronger through the core, you should be able to hit anywhere from 12 to 15 repetitions, 3 to 4 sets. So the next exercises I'm going to demonstrate are your knee rocks. They're really good exercises to help mobilize the joints of your lower back, to help with those with acute lower back pain and also chronic lower back pain. Okay? So to perform the movement, what you want to do is lay on your back with your knees bent, feet flat on the ground, like so, okay? Have your knees together and take a nice deep breath in, and as you breathe out, you want to rotate your hips and your lower back to one side. So when you're ready, breathe in and out. In that position for 3 seconds, breathing in, coming back to the midline. We then want to repeat that on the other direction. So breathing in and then out, and as you exhale, rotating the body to the other direction. Breathing in, back to the midline. Really important to control the breathing throughout. We have respiratory muscles in the lower back. This just helps to disengage them. It's very normal to feel any sort of clicking or cracking when you are rotating. It's a sign that the joints are freeing up and then mobilizing a little bit better. Start off with anywhere between 8 to 10 repetitions on each side, 2 to 3 sets, and as you become more comfortable and as your body can tolerate more repetitions, work up towards 15 repetitions, 3 sets. So the next movement is a glute stretch. To perform this, what you want to do is sit up nice and tall in a chair. You have your feet planted firmly on the floor. You're going to place one ankle of your foot up onto the opposite knee. So for this demonstration, we're going to bring your left ankle up on top of your right knee. Sitting up nice and tall, we are then going to apply some pressure to the left knee. You may, if you're really tight through the hips, you may already start to feel that stretch. But if you want an increased stretch, apply a gentle lean forward, okay? Holding that for anywhere between 15 to 20 seconds, and then coming back to the starting position. I'll show you this on a side view. So you're gonna stretch out the right glute now, so feet nice and firm on the ground, right ankle comes on top of left knee, apply pressure through the right knee. You may already start to feel that through the glute and a touch of the lower back. And then to increase the resistance, we want to slightly bend forward from the torso, holding that for 15 to 20 seconds. And then coming back to the starting position. If you have any pain associated with the movement, try to gradually get into the stretch. If it becomes too much, seek medical help.